Hi, and welcome to the White Coat Podcast. I'm your host, Sachin Chauhan. So, without taking much time, please welcome Dr. Ronak Vyas.
Hello, hi.
तो ऑन्कोलॉजी की तरफ आना कैसे हुआ?
In 2021, we officially announced Airavat Cancer Care's existence.
I would like to understand the leadership quality that you developed by the time.
So, even though coming from the middle class background, actually we chose to have some risk in our life. To be able to run it successfully, you have to tick all the boxes. We should be able to utilize our skill in most efficient way.
Great.
That is why we believe that no patient should left without treatment. And how we are doing it?
Nowadays, number of cases are rising. कैंसर के जो cases हैं वो बढ़ते चले जा रहे हैं rapidly.
Despite knowing everything, we to go for a outdoor dinner or
Street food,
street
और
for
restaurants
everything.
हैं.
जो एक चीज़ है कि जिसने मुझे थोड़ा सा चेंज किया, that was a story of 22-year-old male cancer patient. After 1 month of hustling, he came out of the disease. He went home, he took chemotherapy, but unfortunately just after a year he had the recurrence again. He again developed the cancer, and at that particular time it was of stage 4.
Navjot Singh Sidhu, former cricketer, actually he came up with one idea that he cured the cancer at home.
Lifestyle only pushes a person to consume tobacco, to look cool. अभी कैंसर की ट्रीटमेंट बहुत ज़्यादा प्रोटोकॉल के साथ दी जाती है. See, India is a country of emotions. I mean, you can sell everything here.
Hi everybody, welcome to the White Coat Podcast. In today's episode, our guest is Dr. Ronak Vyas. He is a surgical oncologist and co-founder of Airavat Cancer Care. In today's conversation, we will decode the myths and facts about cancer. So without taking much time, please welcome Dr. Ronak Vyas. Thank you so much for being here and accepting the invitation.
Yeah,
Great.
It's my pleasure.
Yeah. So let's get started. How did you start your journey and how was the starting point? किस तरीके से आपने अपने मेडिकल करियर की शुरुआत करी? वहीं से शुरू करते हैं. Please.
So basically, I am a first generation doctor in my family. Usually during the initial days, बच्चों को वही सिखाया जाता है कि पढ़ाई करिए, आपका करियर बढ़ाइए. So same happened with me. Obviously, I was scholar. So along with many of the students around, it was a constant disciplined efforts during the academic years, which brought me to this field, and it has constantly pushed me and motivating me till now also. So coming from normal background, just normal middle class background, पढ़ाई करते करते MBBS, फिर स्टेट लेवल पे आगे बढ़ते हुए पोस्ट ग्रेजुएशन के बाद I went to Delhi and Lucknow for further training.
Okay.
So after post graduation, I was appointed as an assistant professor in my alma mater, MP Shah Government Medical College, Jamnagar. I worked there for a year, but I wanted to do something extra. I wanted to go beyond what is the comfort zone. So I left it. I resigned from it after a year. I went for senior residency in surgical gastroenterology at SGPGI. Those were also the challenging years, 2015-16. Then again, I came back to Gujarat. I read for almost 6 months. And then in the NEET 2017, I cracked it. I was Gujarat topper there, not national topper, right? So I was getting multiple options, but I wanted to be in Ahmedabad. So I opted for GCRI. I was fortunate enough to get admission into the GCRI as a surgical oncologist. It is the regional cancer center of Gujarat. It has the highest cancer directory of the Gujarat, and many eminent cancer surgeons, many eminent oncologists, many eminent radiotherapists who are currently practicing from the Gujarat has passed out from that institute.
Amazing.
So I was fortunate enough to get into the GCRI in 2017, where I worked for 3 years for my MCH in surgical oncology.
Great.
So that is the whole academic stories kind of
Academic story. Amazing. And I am fortunate to hear it.
thing. Yeah.
तो ऑन्कोलॉजी की तरफ आना कैसे हुआ?
So basically, I wanted to be a surgeon first.
Okay.
So I mean, I took drop in post graduation because I was not getting the surgery at that particular time. So I took a drop and I wanted to be a surgeon first and foremost. So I did my surgery from Ampisha Medical College. Then I have some inclination towards the GI cancer surgery. I mean GI surgeries to be
Okay.
particular. And then I got myself prepared by reading the super specialty book, giving the institute wise some this entrance exams. I went for fellowship in Gangaram. I went for SRship in this SGPGI,
Okay.
and then came the entrance exam. So surgical oncology in broad sense provides multiple subspecialty wise approach to a surgeon, and it also opens multiple option as a surgeon for
As a
me to
surgeon.
uh, जो मेरा रूटीन ब्रेक करके कोई ना कोई चैलेंजेस अलग अलग एनाटॉमिकल केसेस के हिसाब से मेरे सामने है आई मीन
So you wanted to face the challenges,
या एंड
right?
आई मीन इट ऑफर्स everything on the plate.
Okay.
Come on, I mean, you have to do the head and neck, breast, gynec, GI, complex gynec case, thoracic case. So, I mean, it is kind of challenge for a surgeon also. So, I wanted to have that.
मैं जानना चाहूँगा कि जनरली डॉक्टर्स जब बन जाते हैं कोई भी, तो सुना जाता है कई लोगों के थ्रू कि एक डॉक्टर की जो मेन लाइफ है, जो अर्निंग वाली जो है, वो 45 और 50 के बाद में शुरू होती है. लेकिन आपने अंडर 40 आपने अपना हॉस्पिटल स्टैब्लिश किया अहमदाबाद में. सो उसकी स्टोरी बताइए एंड व्हाट डिड यू लर्न फ्रॉम इट एज अ लीडर, क्योंकि जब आप एक अपना बिजनेस स्टार्ट करते हैं तो आप एक लीडर बनते हैं, आप एक टीम को लीड करते हैं, आप बहुत सारी चीज़ों को ऑपरेशनलाइज करते हैं. तो उसका एक्सपीरियंस अपन शेयर करिए हमारे ऑडियंस के साथ.
So, basically, there is always a story behind each business. I mean, whosoever is doing that part, there is one why associated with it. Why someone is starting this, why someone is doing it. So, sort of, हमारा 2020 में MCH Surgical Oncology ख़त्म हुआ.
ओके.
I wanted to be in an institution. I wanted to run a department. But somehow it was a corona time. Situations were a bit changed. Situations were uncertain at that particular time. And me and my partner at Airavat, Dr. Manish, we were the only two surgical oncologists who rolled out in the Gujarat having the MCH degree in the surgical
In
oncology.
that year or
In that year.
in
In
that year?
2020 year,
Okay.
we were the only two MCH surgical oncologists,
Okay.
and that too from the regional cancer center. So we were the only two people. Time was uncertain. At that particular time, we have approached many corporates, whatever there in our connect or our network or our possibility, right? We went to meet different senior doctors also, just to have the insight or what are the options around. But that was the time of layoff.
Okay. And you were finding the jobs.
Yeah, we were
Okay.
finding the jobs.
Okay.
That was time for the layoffs. People were on free for service model, actually
Okay.
without MG. So the scope was not there because the hospital, the society itself was so much within the corona.
Okay.
So there was no scope for the other specialties, right? So it was the first challenge that we faced, that there was no platform to us to perform. See, as a professional, as a doctor, we are the actors.
Okay.
But at least we need some platform to act upon. Then and then only we can display what are our skills, what are our positives, what character do we possess. So at that particular time, there was no platform.
Okay.
And to be very honest, when someone comes into the professional life, he or she passes through the phases of rejection,
Okay.
resistance, then, I mean, early acceptance,
Okay.
and that then involvement within the core group, right? So we face rejection at most of the places to begin with. And then there was resistance also, as we were the new people. uh, the hospitals or the setups were not that much keen to go ahead with the new people, right? So it was the challenge that we didn't find any platform, and we saw that in the critical time that there were some layoff, there were some free for services thing. So it was like a warning light for us at that particular time also. Right now, I feel it is not the scenario for each and everyone. I shouldn't be generalizing that thing. So first thing, there was no option. Then what we saw is like uh, cancer is a, we already discussed, it is a subspecialty
Yes.
approach,
Yes.
and everyone has some interest towards one particular organ or one particular system. One possesses extra skill or extra anatomical mastery over one particular organ. So we realize that group practice should be the way of practicing, or should be the way of looking forward. So that was the another thing. And then if I talk about the private practice, we realize that okay, let's put our efforts first. Let's see how much we are capable of doing it.
Okay.
So there were fears also, there were some hesitation also, but gradually we were like putting through. I mean, right in 2021, we officially announced Airavat Cancer Care's existence with
Okay.
two of my partners, Dr. Rushit and Dr. Manish.
Okay.
And since then, we gradually work in Ahmedabad, I mean in the east and west Ahmedabad, and the few of the centers around the Ahmedabad. And our strong work ethic, I would say, disciplined, constant efforts, because we think that we groom more into the operation theater rather than anywhere else. So it is like doing surgery is like a passion for us, all of us. So gradually we build our cases, gradually we develop rapport within the patient, we develop rapport within the fraternity, and then we were able to, have our venture, which was actually didn't have any infrastructural support, into the existence in 2024, last year. So that is how we build it. I mean, we didn't go ahead with the facility building first. Rather, we first had our clients, our patients, developed trust within them, gave results to them, and then we came up with our venture. I mean, into the realistic world. I mean, some people were telling us Uber of cancer surgery also in
Okay.
2022, 2023.
Why?
I mean, we didn't have the infrastructural facilities, no, I mean,
Okay.
that is why. But, I mean, uh, we have very strong bond and very strong commitment towards each other.
Got it.
And it also reflects into the hospital setups where we are associated with. I mean, we have divided our practice into East and West Ahmedabad from the very first day, and we were very much sure that we cannot move here and there and develop our practice. We
Okay.
have to develop it under one roof. So in East Ahmedabad also and in the West Ahmedabad also, we have constantly worked in the same facility over the last 4 5 years, and that is how we were able to develop our work there only, and that is have created the brand image, that is have given the momentum to the our surgical practice, and also the belief, trust within the patient, because you cannot have your protocol set at different location.
Okay.
So actually our dominant work in East Ahmedabad is at Narayana Hospital.
Narayana Hospital.
Yeah, and at the West Ahmedabad at our setup, where
Yeah.
the protocols are set, way of practice is set, and we have good numbers also at the both the centers. So that is how we have developed the practice.
Great. What a story behind it, and the resilience and commitment that you, three of you, actually have
Yeah.
done. Great job. So you talked about establishment of Airavat Cancer Care. So everything comes with responsibility. So now you, along with your two co-founders, you are leading from the fronts. So as a leader, क्या-क्या challenges है? So please talk about it.
So basically, Airavat was an idea. Actually, we all come from the first generation of doctors, three of us, right? And we want to build a thing कि जिसमें कोई भी मरीज विदाउट ट्रीटमेंट ना रह जाए.
Okay.
मैंने पहले ही बताया कोई प्लेटफॉर्म ही नहीं था काम करने को. बट ग्रेजुअली आई वुड से आई एम ग्रेटफुल, आई वुड से वी आर ग्रेटफुल that we had the opportunity to perform at different places, right? And after 5 years of practice, we were able to make platform for our patients where a person can take treatment in a very high class facility. We are able to give treatment under PMJ also. And I am associated with one medical college. Similarly, my partners are also
Yes.
associated with medical college. So we often operate for free also. And I mean, we are very proud that we are able to create the platform where no patient can left without treatment. Number one thing.
Great.
Number two thing that we believe in strong ethics. We believe in strong commitment, and that is why I mean, whenever I meet other professionals out there, so I made it them very clear that I mean no one can teach us commitment, because
Correct.
I mean we are the people who have been committed to each other. It has been reflected in our practice also to for our patients also, and with our hospital setups also where we are working. Now comes the challenges. So actually see, in any entrepreneurship or in any self-owned business, you may say, or for a doctor, a private practice, to make it successful, you have to tick all the boxes.
Okay.
You should be skillful and knowledgeable enough. The margin of error is very less, and it is especially minimum or zero when you are working in a metro city.
Okay.
Right? Your treatment plans or your medical care should be standardized. Apart from there, your networking should be good, your marketing strategy should be good, you should have depth knowledge about accounts, compliances, your character being reflected on your staff or
Exactly.
at the place of your working, it should be up to the mark. So as a team, we are able to tick all the boxes correctly. I hope so. And for one person, it should be a 5 years. But
Okay.
for us, it is like a 15 years.
15 years.
For us, a week is 21 days.
Okay.
And I would say with the fourth doctor coming in our team, it is like a 28 days for us.
Okay.
So we are pulling maximum out of it. So this is like, I mean, we are able to create a culture around it,
Correct.
us, which is based on 3T, I would say.
Okay.
Truthfulness,
Okay.
transparency, and trust.
Great.
And that is being reflected in our patient commute also.
Okay.
We are truthful to them. We are truthful to our learnings and our education, and it is being reflected in our day-to-day commute, in
Okay.
our professional, professional commitment or professional work ethics with the hospitals where we are associated with. Then comes the transparency execution.
Yes.
Transparent execution, I mean, we make aware everything crystal clear to our patients about the treatment part, about the finance part, about the post-op part, and all this thing brings the trust.
Great.
So actually the practice works on this basic elements.
Okay.
Apart from that, it is a cultural driven practice
Okay.
where we are very much clear that the ethical uh, approach, may it be in the practice or may it be in the professional work, should be maintained. Discipline should be maintained. No one is taking any chutti or
Okay.
having fun days on the regular basis. Everyone is putting their efforts, very hard efforts,
Okay.
and persistent efforts, not for only time being. It is
Okay.
past 4 and 5 years, and that has make the culture around it. So our staff, our non-clinical team, marketing team, you might say, so everything is within that culture only. So we have given importance to values around it. So
Great.
that is how the work division is there.
Yes.
Everyone is doing their role and no one is making noise about it. So work division is very much there. Responsibility division is very much there. And as a team we know who is having the upper hand in particular thing,
Correct.
and internal respect is there. So as a, if I say about the hospital place, we are able to negate the challenges that a single person could have.
Correct.
And I already told that we have made the 5 years into the 15 years
15 years.
by putting enormous efforts into it. So that is how the thing is going at our end.
That's make a nowadays number of cases are rising. कैंसर के जो केसेस है वो बढ़ते चले जा रहे हैं रैपिडली. सो व्हाट आर द मेन रीजंस बिहाइंड इट? लाइफस्टाइल है, फूड है, या फिर कुछ और रीजंस हैं? ये तो जनरली हमको पता चलता है थोड़ा बहुत एज एन ऑन्कोलॉजिस्ट. व्हाट डू यू एक्चुअली बिलीव इन दिस?
सो बेसिकली लाइफस्टाइल मॉडिफिकेशन तो है ही बहुत ज़्यादा. आप नंबर्स देखो तो एवरेज एज एट मैरिज, एवरेज एज एट फर्स्ट चाइल्ड, कंजम्पशन ऑफ एडिक्टिव products such as tobacco, alcohol, some other products also is easily available in the current scenario, right? Second है food products. Basically all food products, most of the food products are re-engineered food products.
Okay.
I mean, there are additional additives, flavors, chemicals to make it more worthy of prolonged shelf life or more tastier, something like this. और उसका कंजम्पशन बहुत छोटी एज से बढ़ रहा है. आई मीन इफ यू फील राइट. साथ में अगर आप देखो, आई मीन वी आर नॉट गिविंग इट मच इम्पोर्टेंस, बट इफ यू लुक अराउंड, वी आर नॉट हैविंग healthiest of air, we are not having purest of water, we are not having healthiest of food products to consume, right? So all these factors are coming together. साथ में usually because of certain this chemical, there are some mutations also happening at the core level, and that is causing the problem.
Okay.
ये सारी चीज़ के कारण there are more and more patients coming up with the cancer because there is more of the obesity, more of the hormone related changes, more of the consumption of these adulterated food products, and unfortunately we don't have the regulation over the food products. Okay. Neither from the policymakers side, and also we are also taking it in a very subtle way.
Okay.
We also don't take care of what we are consuming.
Okay.
Whether it is good or not, I mean what is the quality of it. Despite knowing everything, we go for a outdoor dinner or
street food or
for
restaurants,
everything.
yeah.
And we are not bothered about the quality of the products most of the time.
Okay. एक और क्वेश्चन आता है यहाँ पे कि ऐसा लगता है कि जो लोग अल्कोहल नहीं कंज्यूम करते हैं और टैबेको नहीं लेते हैं उनको भी कैंसर होता है, तो उनके रीजंस क्या हैं? व्हाट आर द मेन रीजंस बिहाइंड दैट?
सो बेसिकली मैं वही बताने का आपको
Yes,
चाह
please.
रहा हूँ कि tobacco, alcohol, some hormone related drugs which is causing cancer in the females, they are the actually harmful products
Okay.
which we are consuming. And it is proven over and over decades and centuries that this is causing the problem, but we are consuming it. But apart from tobacco and alcohol, if you see, we are, I already mentioned, we are not breathing the quality air.
Correct.
We are having the adulterated food products in our consumption, right? सो ये सारी चीज़ें केमिकल ही है, सारी चीज़ें प्री कैंसरस ही है जो अपन रेगुलर बेसिस पे कंज्यूम कर रहे हैं विदाउट नोइंग इट दैट इट विल एक्चुअली मोर हार्मफुल देन द टोबैको इटसेल्फ. आई मीन आपने शायद सुना होगा कि मिल्क में यूरिया डाल के आज 100 किलो दूध पकड़ा गया,
हाँ.
कहीं पे पनीर पकड़ा जा रहा है, कहीं पे नकली घी पकड़ा जा रहा है. ये तो खाली आई मीन टॉप ऑफ द आइसबर्ग न्यूज़ है जो आपको पता चल रही है. एक्चुअली आपने कितना नकली घी अभी तक कंज्यूम किया होगा या कितना नकली पनीर कंज्यूम किया होगा, या तो आप रोज एडल्टरेटेड दूध कंज्यूम कर रहे हो, और आप तो कर रहे हो, आपके बच्चों को भी करवा रहे हो. तो वी आर नॉट अवेयर ऑफ द सिचुएशंस राइट नाउ. एंड व्हाट आई बिलीव दैट एज अ सोसाइटी इफ वी आर निग्लेक्टिंग इट, then we cannot blame our government for it.
Correct.
Because government will only do what you people will ask to do.
Correct.
And we are, I mean, it is not in our priority list right now. I believe as a society. So खाली तंबाकू अल्कोहल से कैंसर होता है वो पुरानी बात हो गई.
अच्छा.
I mean there are many much more things which needs to be looked upon.
Okay.
Other important factor is lifestyle.
Got it.
Because एक सेडेंटरी लाइफस्टाइल, एक प्रोफेशन ओरिएंटेड लाइफस्टाइल, पर्टिकुलरली उसके इम्पैक्ट ऐसे आ रहे हैं कि जो एज एट मैरिज है, एज एट फर्स्ट चाइल्ड बर्थ है, वो फीमेल में नियर 30 पहुंच गया है, राइट?
Yes.
जो सेडेंटरी लाइफस्टाइल है, कंजम्पशन ऑफ द जंक फूड वगैरह है, लैक ऑफ एक्सरसाइज है, लैक ऑफ फिजिकल वर्क है, वो ओबेसिटी में ट्रांसफॉर्म हुआ है. तो वो सारी चीज़ें प्री कैंसरस है. आई मीन मोस्ट ऑफ द कैंसर्स आर प्रिवेंटेबल.
Okay.
एंड द मोस्ट कॉमन कॉज विच आई सी इट्स बिकॉज ऑफ द लाइफस्टाइल. दैट लाइफस्टाइल ओनली pushes a person to consume tobacco, to look cool.
Yes.
For a smoke or a vape or for a alcohol to look cool. And that will lead to its domino effect later on, right?
It will definitely help the people, those who are watching it. So let's move further. एक बहुत ही जनरल क्वेश्चन है कि मेल और फीमेल्स के अगर हम देखें तो उनमें कौन से टाइप के जो कैंसर्स हैं जो बहुत ही कॉमन देखे जाते हैं. और रिसेंटली वाइल आई वॉज जस्ट ट्राइंग टू कनेक्ट विथ यू, सो आई वॉज जस्ट लिसनिंग वन डिफरेंट टाइप ऑफ न्यूज़ कि मेल्स में भी ब्रेस्ट कैंसर देखा गया है.
सी देखिए, कैंसर के केसेस रीजन के डिपेंडेंट होते हैं और जेंडर के डिपेंडेंट होते हैं मोस्ट ऑफ द टाइम. जैसे हम गुजरात बेल्ट की बात करें तो यहाँ पे गुजरात राजस्थान में टोबैको का कंजम्पशन बहुत ज़्यादा है.
आप ये कहना चाह रहे हैं कि इंडिया में सबसे ज़्यादा टोबैको कंजम्पशन गुजरात के अंदर है?
आई मीन यूपी, बिहार, गुजरात.
ओके.
दे आर द लीडिंग
Got it.
regions where tobacco consumption is enormous,
ठीक
right?
है.
So मैं अगर गुजरात की बात कर रहा हूँ तो गुजरात में टोबैको कंजम्पशन बहुत ज़्यादा है. तो उसके चलते देखने जाए तो यहाँ पे टोबैको रिलेटेड कैंसर जैसे कि ओरल कैविटी कैंसर, थ्रोट कैंसर, फूड पाइप कैंसर, उसके नंबर ज़्यादा है.
ओके.
मेल्स में मोस्ट कॉमन कैंसर लंग कैंसर है बिकॉज ऑफ I mean the smoking and tobacco consumption, right? Then comes the oral cavity cancer.
Okay.
फिर फीमेल्स की बात करें तो मोस्ट कॉमन कैंसर इज ब्रेस्ट कैंसर because of the lifestyle modification which has occurred over a period of time, right? Then comes the cervical cancer.
Okay.
Now मैं रीजन की भी बात करूं तो जहाँ पे जैसे आप डेजर्ट एरिया की बात कर रहे हो, नॉर्दर्न गुजरात की बात कर रहे हो, या तो साउथ राजस्थान की बात कर रहे हो, तो वहाँ पे पानी पीने का कंजम्पशन का रेट थोड़ा कम है, गर्मी ज़्यादा है, लोग खेती ज़्यादा करते हैं, तो उनमें ब्लैडर कैंसर का भी प्रमाण अर्बनाइज पॉपुलेशन से ज़्यादा देखने को मिल रहा है.
ओके.
फीमेल की भी वहाँ पे बात करें तो सर्वाइकल कैंसर इज़ एसोसिएटेड विथ HPV वायरस इन्फेक्शन, लैक ऑफ हाइजीन, कंजम्पशन ऑफ टोबैको, तो वो रूरल पॉपुलेशन में ज़्यादा देखने को मिल रहा है. ब्रेस्ट कैंसर की बात करें तो इट इज़ मोर इनटू द अर्बन वर्ल्ड बिकॉज ऑफ लाइफस्टाइल मॉडिफिकेशन, prolonged hormonal exposure to a female, less number of child, avoidance of the breastfeeding because of professional commitments, and so on and so on and so forth. The thing behaves in that way. So males में most common lung, oral cavity, then throat cancers, GI cancers. Female में most common breast, then cervix, then the ovarian malignancy, lung also it is common. अब आपने पूछा था कि मेल में भी ब्रेस्ट कैंसर क्या हो सकता है. यस, बेसिकली अमॉन्ग द ब्रेस्ट कैंसर केसेस only 1% of the cases are seen into the males. Not all males develop breast cancer, but if someone is having genetic predisposition, so because of that usually male breast can also have the breast cancer in a similar way a female would have. But cancer is associated with some taboo, some this thing.
कि कैंसर का नाम सुनते ही लोग घबरा जाते हैं. मैंने कई फैमिलीज़ में देखा है, एंड आई पर्सनली फेल्ट इट इन माय फैमिली. जब भी पता चलता है और डिटेक्ट होता है, फैमिलीज़ तो वहीं पे हिम्मत हार जाते हैं, एंड दे जस्ट फील लाइक कि अब कुछ नहीं होगा, कि एवरीथिंग एंड्स हियर. तो वुड यू मस्ट प्लीज़ स्पीक अबाउट इट कि क्या सिचुएशन होती है उस टाइम?
आई मीन देखो, कैंसर के आसपास हवा बहुत ज़्यादा बनाया हुआ है. बट बेसिकली पास्ट 5-10 years मल्टी मोडालिटी ट्रीटमेंट का बहुत ज़्यादा इन्वॉल्वमेंट हुआ है कैंसर ट्रीटमेंट में, जिसमें मल्टी मोडालिटी मीन्स कोई एक कैंसर को ट्रीट करने के लिए एक डॉक्टर की जगह पे टीम ऑफ डॉक्टर्स, टीम ऑफ कंसल्टेंट्स आर कमिंग टुगेदर टू ट्रीट इट, टू गिव द precise personalized care to the patient is being practiced in a more efficient way in last 5-10 years, if I compare it to the earlier times. कि जिसमें मेडिकल ऑन्कोलॉजिस्ट, सर्जिकल ऑन्कोलॉजिस्ट, रेडियोथेरापिस्ट मिलके एक मरीज़ को ट्रीटमेंट प्लान आउट करके देते हैं. तो अभी कैंसर की ट्रीटमेंट बहुत ज़्यादा प्रोटोकॉल के साथ दी जाती है, एटलीस्ट इन द मेट्रो सिटीज़, राइट, और इन द गुड सेटअप्स. तो जो सर्वाइवल जो पहले नहीं मिलता था, तो वो अब ऐसी बात नहीं है. आई मीन विद द एडवांस ट्रीटमेंट इन एवरी फील्ड, आई मीन इफ़ आई टॉक अबाउट द सर्जिकल ऑन्कोलॉजी, तो लेप्रोस्कोपी, रोबोटिक सर्जरीज, साइटोरिडक्टिव सर्जरीज, हाईपैक, पाईपैक, use of ICG techniques. I mean, many modalities have come for the better care for the patient. मेडिकल ऑन्कोलॉजी में बात करें तो इम्यूनोथेरापी, टारगेट थेरापी, उन सब से भी बहुत ज़्यादा सर्वाइवल बढ़ा है. सो फर्स्ट एंड फॉरमोस्ट इससे घबराने की ज़रूरत नहीं है. एटलीस्ट दूसरा, इंडियन सोसाइटी की बात करें तो वी आर मोर कंसर्न अबाउट आवर सराउंडिंग, about how the society would react, how the family would react, how the other person would react. I mean, I would like to tell the people who are listening to us that, I mean, when you are suffering from something which is as big as cancer, you do not have to worry about the people around you, what they will think, whether I am a burden on them, because it is your life, your decision. And if you are finding any abnormality in your body or body parts or any symptoms pertaining to it, you just have to consult the doctors. पहले के ज़माने में ऐसा था कि डॉक्टर को मिलना was like a, I mean, big thing. But right now it is not like that. We are into the growing society.
Yes.
So इसको टैबू बनाने की कोई सच कोई ज़रूरत नहीं है.
Okay.
Even society needs to understand also, because even now the people who are coming, they are afraid of using the term even after treatment also.
यस, कुछ लोग शेयर करना पसंद भी नहीं
शेयर
करते हैं.
करना पसंद नहीं करते हैं, अपनी फैमिली में किसी को बताना पसंद नहीं करते हैं. पर मुझे ऐसा लगता है कि अगर कैंसर की सुनामी को कम करना है तो वी हैव टू टॉक अबाउट इट मच एंड मच.
आई मीन वोकल होना पड़ेगा इसके बारे
वोकल
में.
होना पड़ेगा, तो ही अपने उसके रिस्क फैक्टर के बारे में भी ज़्यादा अवेयरनेस फैला सकते हैं. तो ही अपने लोग उसके सिम्टम्स के बारे में अवेयरनेस फैला सकते हैं. बिकॉज कैंसर में एक चीज़ बहुत मायने रखती है ट्रीटमेंट में, कि इफ़ यू आर कमिंग इन अर्ली स्टेज देन योर लाइफ वुड बी लाइक द नियर नॉर्मल पीपल. बट इफ़ यू आर कमिंग लेट then you are wasting your golden time. Coming in the late stages means, I mean, you have lost the time.
करेक्ट.
So एक पब्लिक डोमेन में अगर ये टैबू जैसी चीज़, या तो ये एक शर्म जैसी बात में से ये निकल के बाहर आएगी, तो ही उसके सिम्टम्स, रिस्क फैक्टर्स, और जो मैंने अभी ये बात कही कि आवर प्रायोरिटी इज़ नॉट द क्वालिटी ऑफ व्हाट वी कंज्यूम,
करेक्ट.
तो उसके बारे में बातें होना शुरू
हो
होगी.
जाएंगी. हाँ.
तो ही पॉलिसी मेकर्स, एडमिनिस्ट्रेटर्स उसके प्रति थोड़ा सीरियस होंगे. एंड देन ओनली वी कैन have some decrease in the numbers. And also the people coming into the early stage to us.
Yes.
If they are coming in early stage to us, then and then only we can give them near normal life.
What can be the tests any person can do in order to prevent to reach on the like serious situation? और कौन से tests किसी को भी करा लेने चाहिए before just seeing this situation, please?
So basically it is like knowing the symptoms. Everyone should know about the symptoms. अगर कोई बंदा तंबाकू पान मसाला खा रहा है और उसके मुंह में 15 दिन 20 दिन से चांदी पड़ी हुई है,
अच्छा.
या तो फिर खून निकल रहा है, एंड ही इज निग्लेक्टिंग, देन ही इज वेस्टिंग द टाइम.
Okay.
Right? If someone is having the lump in the breast and if they are neglecting it, then they are wasting the time. I mean, क्योंकि कोई भी बंदे को नेगेटिव न्यूज़ नहीं चाहिए.
Correct.
It is very difficult to accept that I am having the cancer.
Yes.
Right?
Yeah.
On a personal level.
Correct.
But you cannot be that foolish कि आप उसको neglect ही कर रहे हो. So any chronic problems in any of the organs which is lasting more than some weeks, it should be checked. अब जैसे मैं मुंह के कैंसर की बात करूं, तो किसी को 15-20 दिनों से मुंह में रह रहा चांदा या छाला, किसी को मुंह में से खून आना, किसी को दांत का अपने आप ही हिलना,
अच्छा.
गले में किसी को गठान मिलना. ब्रेस्ट कैंसर की बात करूँ तो फीमेल्स को ड्यूरिंग द सेल्फ एग्जामिनेशन, ड्यूरिंग बाथिंग और एनी टाइम, इफ दे आर फीलिंग समथिंग, दे शुड चेक देयर सेल्फ.
Got it.
पेट के कैंसर की बात करूँ तो कांस्टेंट इंडाइजेशन, कांस्टेंट पेट में दर्द, कांस्टेंट आई मीन एक चेंज इन हैबिट ऑफ eating, or you know, passing stool, finding blood in the stool or black color stool, these are the symptoms which shouldn't be neglected.
Okay.
So if you are neglecting it over a period of time because of the commitments, so you are missing the golden time. I mean, it is just a phrase, but it is like you should be aware of the symptoms, right?
Okay.
And the second thing you
I was
asked,
asking about the what are the tests that
Tests,
anybody
right. Yeah,
can
yeah,
have.
सो कैंसर में उनको स्क्रीनिंग टेस्ट बोलते हैं.
Okay.
मैंने पहले ही बताया कि कैंसर एक ऐसा डिसीज़ है जिसको प्रिवेंट किया जा सकता है.
Yes.
एंड मोस्ट ऑफ द केसेस आर बिकॉज ऑफ द लाइफस्टाइल. पर कुछ कुछ कैंसर में ऐसे भी टेस्ट हैं कि जो अपने रेगुलर बेसिस पे कराएं तो उनमें कोई पाने जाने वाली एबनॉर्मलिटी कैन वार्न यू.
ठीक है.
उसमें जैसे ब्रेस्ट कैंसर की बात करें तो स्क्रीनिंग मैमोग्राफी,
Okay.
that to be done after 40 years annually once
Okay.
till the age of 55, and after that biannually.
Okay.
अगर किसी की फैमिली हिस्ट्री स्ट्रॉन्ग है ब्रेस्ट कैंसर की, तो उनको थोड़ा अर्ली एज पे ये मेमोग्राफी चालू कर देना चाहिए, राइट? इट इज़ जस्ट लाइक अ नॉर्मल टेस्ट एंड इम्पोर्टेंटली इट इज़ टू बी डन एन्युअली ओनली. साल में एक दफ़ा करवानी है. पुरुषों में जैसे बात करें तो प्रोस्टेट कैंसर के लिए प्रोस्टेट स्पेसिफिक एंटीजन सीरम PSA ब्लड टेस्ट है.
Okay.
दैट शुड बी डन आफ्टर द एज ऑफ 60, राइट? सो जैसे किसी को बॉवल ब्लैडर में बॉवल में कुछ एबनॉर्मलिटी है, जैसे स्टूल पास करने में प्रॉब्लम है, किसी को फैमिली हिस्ट्री है, तो दे शुड बी गेट चेक्ड बाय कोलोनोस्कोपी or endoscopy for the upper GI problems, right?
Got it.
So these are the screening tests. There is right now no single test available
Okay.
to diagnose the cancer earlier.
So there are
Right.
multiple tests are available. for
Multiple
different kind
tests pertaining to the cancer part,
Okay.
right? So these are called the screening test.
Yes.
And screening tests are available for GI cancer such as upper GI scopy or colonoscopy, for breast mammography, for cervix pap smear test is there.
Got it.
For prostate it is blood test, simple blood test. So range of tests for different type of
Different
cancers
types.
is there.
AI is coming into healthcare rapidly. So is it helping you as a doctor,
No.
or it is many people are talking about it on different platforms like LinkedIn and other platforms that AI will replace the doctors? So there are two questions I would love to hear from you.
So see, AI is a boon
Yeah.
because it will smoothen the functions, it will smoothen the operational work also, it will mitigate the chances of error
Okay.
in the planning, because किसी भी चीज़ को assess करना it is different for different people. It is absolutely a subjective analysis. But when AI comes, or any technology with more intelligence than you, it will help in the planning of treatment. It will decrease the chances of minimization, doing any error to any patients.
Okay.
As far as cancer care is concerned,
Like question is like, will it replace the doctors?
no,
Okay.
it won't.
Okay.
See, medical and education are the things where the human touch is most important.
Most important part.
You cannot learn everything just by watching the computer or learning things on the YouTube.
Great.
You need a teacher.
Okay.
You need a human shoulder. You need a human emotions there
Okay.
that can, shape you in your ups and downs. And similarly in the medical practice also, without the human face, without the human involvement, you cannot replace completely doctors because challenges are too much.
Okay.
In India, there are range of people. 140 crore population is there. Not everyone is coming from the single strata.
Yes.
If I talk about social background, economic background, regional prospects or regional aspects are being considered. So someone is coming from very far rural area, someone is from urban area, someone is from the metro city. Priorities are different. So AI cannot completely, replace the doctors. But
Doctors.
yeah,
It will help doctors.
I feel that the technology should be used in a better way by us.
to make it
to-
faster and smoother.
Make treatment more precise,
Precise. Okay.
to make treatment more personalized, and to minimize the chances of error both in surgical and both in medical
Medical.
use. Right?
Recently, few months back, there was a case actually booming in social media. Navjot Singh Sidhu, former cricketer, actually he came up with one idea that he cured the cancer at home. So please talk about it. What do you understand by it? Because इससे काफ़ी रूमर्स भी फैले थे, कुछ लोगों ने अपोज किया, डॉक्टर्स के फ्रेटर्निटी ने उसको अपोज किया कि ऐसा नहीं होता है, यू आर एक्चुअली बीइंग सेलिब्रिटी, अगर आप ऐसा बोलोगे तो लोगों का ट्रस्ट जो है वो साइंटिफिक जो ट्रीटमेंट होता है उससे कहीं ना कहीं कम हो जाएगा. सो व्हाट डू यू थिंक अबाउट
See,
इट?
India is a country of emotions.
ओके.
You can sell everything here.
या.
I can sell a story also here just by sitting here.
ओके.
So ideally, you cannot silence anyone, first and foremost. And the other thing, usually what I see that people are having a different, experience or emotions with one single thing.
Okay.
Uh, it is up to the belief of someone, I would say. If Sidhu feels that he has treated her wife with
Home remedies,
some
yeah.
home remedies,
Yeah.
and it is his feeling.
Okay.
But to be, honest, he has taken treatment,
Okay.
which is the standard treatment for breast cancer,
Okay.
and that too from prominent oncologist of Chandigarh,
Okay.
right?
Mhm.
So he has undergone the treatment, but there might be vested interest also. There are some inclination towards one thing and some inclination towards the other thing. So I will not like to go deep into
Deeper side of this case,
this,
okay.
but he has taken the standard treatment which any patient receives
Okay.
from any oncologist.
Got it.
Now, using the Ayurvedas or homeopathy or some home remedies, or avoiding such certain consumption, it is just a personal belief,
Okay.
I would say, right?
Got it.
And I already told that India is a country of emotion. You
Emotions, yeah.
cannot silence people, or you
Correct.
cannot play with their beliefs. So I will like to stay away from
Stay away from this kind of news.
such
Okay.
any sort of allegation or any sort of things.
Okay. So I have a very like personal question. Right, in the last 10 to 15 years, you are into medical healthcare. Any story, any patient, can you just talk about any story that you still actually have in your mind,
I mean,
very close to your heart, कि आपने treat किया किसी को और that remained in your mind till now?
नहीं ऐसी बहुत सारी स्टोरी एवरी डे एवरी पेशेंट इज अ स्टोरी फॉर
Okay,
मी राइट
okay.
आई मीन एवरी person coming to me is a different set of person who I am meeting just before someone, right?
Okay, okay,
So every cancer patient is a story.
okay.
There are emotions, there are some expectations. Sometimes they are very happy, sometimes I am very happy, sometimes I am into some disbelief ke how this happened.
Okay.
I mean, sometimes I am not feeling good even after treating them successfully. Okay यार इसको वापस नहीं आया कैंसर या इसको कुछ हो नहीं. बट आई मीन जो एक चीज़ है कि जिसने मुझे थोड़ा सा चेंज किया, दैट वाज अ स्टोरी ऑफ 22-year-old मेल
Okay.
cancer patient who came to the emergency in with distended tummy, vomiting actually feces out of his mouth
Mouth.
because it was huge obstruction, because our intestine are just like a pipeline. If there is any obstruction, then water won't flow. Similarly, the feces won't go to the intestine place and it will come out through the mouth, right? So he came into the emergency. We operated upon him with right hemicolectomy, for the right colon cancer.
Okay.
And then he had post-operative complication. For that he was reoperated 3 times later on.
Okay.
It was a 1 month of juggling and hustling every day to make him live, because he was the only kid of his parents.
Okay.
He was 22 years. So I was very emotionally attached, and after 1 month of hustling, he came out of the disease. He went home, he took chemotherapy, and I again met him after 3 years.
Okay.
He came to give me his invitation for the marriage after
Okay.
3 years, right? So, and already I was emotionally attached at that time. I'm talking about 2016-15.
Okay.
Before 7-8 years.
Got it.
But unfortunately, just after an year, he had the recurrence again. He again developed the cancer. And
Okay.
at that particular time, it was of stage 4. So, that particular thing made me pessimistic about cancer at that time.
Okay.
I was very much worried about, being attached emotionally with the patient or with the thing. And even now, I mean, it has changed me in a way that I have to be a realistic.
Okay.
And during the surgical practice also, I mean, I have operated in a 4-year-old uh, kid also,
Okay.
and I have operated on a 84-year-old elderly also. But after that incident in 2015, 2016, it made me realistic. I mean,
Okay.
I have stopped fantasizing things
Okay.
for me also and for patients also. I mean, I have been more realistic and more science oriented person than.
So that's wonderful because I'm learning a lot, and I believe that people, those who will watch this particular episode, they will learn a lot from you. And so now let's coming to the part. Any 5 things that you would suggest that can prevent this disease called cancer? Just suggest to the people.
So basically, maintaining healthy lifestyle, exercise regularly, taking healthy food. I mean, I would say quality healthy food, right? Third, avoid consumption of tobacco products or alcohol. And even if you are consuming, I mean, be aware of the warning signs, right? Fourth, use screening test wisely.
Okay.
I mean, see, you cannot change everything around you, but you should be aware of the screening test and get self and your loved one checks regularly for that. So this is what it is.
Thank you so much. Now we are coming to the part which is a little bit fun activity.
Yeah.
So actually, I'm very excited to ask these questions, and all the questions that I asked, and you wisely answered all the questions, and I'm sure that we all will learn from it, from your experience that you have shared. So I have few questions that is called rapid fire. Are you ready for that?
Yeah, yeah.
Okay. So one word that patients actually always say about you. Any word that you often just hear the one word from your patients.
સાહેબ સારું થઈ જશે ને.
Okay, okay. After the hectic schedule, what exactly you would like to have? Coffee, chai? So you are a coffee lover or chai lover?
No, no. So coffee.
Okay.
But actually, for me, it is like, a way of meditating. In surgical theater, it is like a meditation. Doing surgery, it's like meditation for me.
Okay.
And I often say to my colleague that we are fortunate as a surgeon because we have, I mean, one more place to have orgasm.
Great.
And that is the operation theater. So
Okay.
usually hustle full day or any after tiring day, I mean, I would like to
Love
be
to
with
have
the
coffee.
family,
Okay.
my daughter, my
Great.
wife. So this is like a stress buster.
Okay. So next question is like, if not doctor, then what? In which profession you would like
I
to
would
jump
like
into?
to be a government officer.
Government? Any particular service?
Obviously UPSC.
UPSC. It means you would like to become IAS officer or
No, I already told that I like challenges.
challenges you.
And I mean, I believe
Okay.
that everyone's existence
Okay.
comes with certain responsibilities. If I am a knowledgeable guy, if I have chose to become a doctor, then I have to give 100% to this particular field.
The next question is like, how do you react when people ask uh, the opinion and advice from you when you go to the party? डॉक्टर एक एडवाइस चाहिए या फिर डॉक्टर जो फ्री में एडवाइस मांगते हैं लोग. So how do you react on that?
No, it is not free advice. I mean, people
Okay.
usually ask this thing.
Okay.
But I mean, on a lighter note, मेरे को पार्टी में कोई कुछ भी बोलता है तो मैं बोला okay, it's your life, live it fully.
Okay.
See, I mean, apart from tobacco or alcohol, there are much more important things that we are consuming which is adulterated.
Correct.
It is the only thing that we don't know. Subconsciously, we have accepted that what we are breathing is fresh, what we are eating is healthy, what we are drinking is pure.
Great. So I have 2 more questions in the rapid fire. Okay. So first one is, to whom you admire the most? Is there any person that you
My father.
respect? Your father.
Yes.
Okay, that's great. One more question. Any application in your cell phone that you use the most and you can't live without it?
WhatsApp,
WhatsApp. Okay,
because
that's
I
amazing.
often get reports on them.
Okay, that is amazing. So we are done with the questions.
Okay.
If you would like to ask any question, that would be great. Or I would like to thank you because you have given this chance to ask these questions because I know that doctors are really busy and you are so much busy and you have taken some time to uh, to to teach us, I would say, and to make the people aware about
Yeah.
all these things. So thank you so much.
Thank you. My pleasure.
Right,
Yes.
and I would like to thank Dr. Ronak Vyas, and I would like to ask all the people, those who are watching this particular episode, I enjoyed it and enjoy से ज़्यादा बहुत कुछ सीखा and hopefully आप भी कुछ सीखेंगे इससे. So if you are watching it, please share this episode with your family members ताकि उनको भी कुछ सीखने को मिले और वो भी किसी बड़ी बीमारी से बच जाएं. If you liked it, then subscribe the channel as well and share it with the people. Thank you so much.